Welcome, viewers and listeners, to the Health Revolution, the program that shows you how to have a life of vibrant well-being. In a world full of noisy health trends, we bring you clarity. In a sea of fads, we reveal the science-backed strategies that truly work. We explore the physical strength, emotional resilience, and mental mastery. These are the keys to an enriched life. Join us for inspiring interviews with champions who conquered life's health challenges. Are you ready to unlock your potential to live with vitality and purpose? Then join the Health Revolution. I'm your host, Adriana Morrison, health and fitness expert, speaker, and a mom who understands. Let's embark on this transformative quest. Together, we're about to change the game, starting now. The information provided in this show is intended for educational and entertainment purposes only. Viewers should use their own discretion and consult with a healthcare professional for personalized guidance and recommendations. Welcome, everybody. You are watching the Health Revolution, and we are excited that you are joining us today. I'm your host, Adriana Morrison, and no matter which way you are tuning into us, whether it's Roku, Apple, Amazon Fire, even LinkedIn, or any of the social media handles, please remember, don't forget to hit the subscribe button. We want to stay connected to you. In addition, at the bottom of your screen, there is a tab for show episode notes. Pay close attention. There's some valuable information and takeaways from today's episode. And today I'm excited to talk about something that we all generally in society understand is important to us, and yet we don't talk about it enough. And that is what the impact of skin health and skincare does to our life as we are going through the aging process. Now, of course, you know, we're getting older. We're not necessarily old per se. And so what do we do to manage that? How do we combat? What are some things that correlate to having a healthy, vibrant life? So my guest today is somebody who's well-versed in that. I'm excited for you to get to know her. Take a look at this. Meet Dr. Alice Mina, a Harvard-trained, double-board certified dermatologist and dermatologic surgeon dedicated to helping women over 40 achieve better skin health. With over 15 years of clinical experience, Dr. Mina addresses common skin concerns such as aging, sun damage, and hormonal changes. At Balcom and Mina Derm Surgery in Atlanta, Georgia, Dr. Mina combines advanced surgical and cosmetic procedures to restore and maintain healthy skin, helping women feel confident and radiant. As the host of the Skin Real podcast, Dr. Mina offers real skincare guidance, focusing on holistic and preventative approaches to skin health and aesthetics, especially for mature skin. Today, we get to dive deeper into understanding how skin health correlates to our aging experience and how Dr. Mina's approach guides many through the unique skin challenges that impact our health. Dr. Mina, welcome to the show. How are you?
Oh, I am great, and I'm thrilled to be here. I love your show, and just to be on it is such an honor. So thank you for all you do.
Oh, we appreciate your time, energy, and nuggets. And diving right into it, what does it mean to be double board certified in dermatology, and what got you into this field?
Oh my gosh, great questions. And yeah, sometimes people think, oh, you must have known since you were 5 you wanted to be a doctor, but actually not the case. So I actually was a dancer, a ballet dancer, and really into the visual arts. I love to draw and paint. And I thought that was going to be my career until I was in my early 20s. I got injured, and I realized I wasn't probably most likely not going to have this illustrious career as a ballet dancer at a top company. And I realized there must be something else out there for me. And I always loved science, and I knew I wanted to help people. And I think as soon as I decided I wanted to go to medical school, I said, I want to be a doctor, and I also want to be a dermatologist. I just loved the visual aspect of dermatology. I've always been excited when like my sister had a rash or I had a plantar wart, and just loved that you could look at something and know what it was just with your eyes. And so that really led me to dermatology. I feel like it's a really creative field. I get to do procedures and work with my hands. And so I'm actually double board certified. So after my residency in dermatology, I went on and did a fellowship, which is like extra training to subspecialize in dermatologic surgery. And so sometimes people say, oh, is that plastic surgery? And there's a good bit of overlap in some of the reconstructive procedures that we do. I treat a lot of skin cancer. I remove a lot of cysts and lipomas and benign skin lesions. And so my practice mostly is focused on procedural dermatology, more so than like general dermatology and stuff like that. And it's been a lot of fun. I love what I do. I love taking care of my patients. And I find that if you can help someone with their skin condition because it's so visible, you can really change their life. And so it's super rewarding.
There is a correlation with our skin, the skin being the largest organ in the body, and how it transcends our overall health. What is it that we don't know or recognize as a society that determines how healthy we are based on our skin condition?
Yeah, well, I think a lot of times people think of the skin as just beauty and aesthetics, which there's a huge role in that, and evolutionary reasons for that, and there's roles for that. But our skin is so much more than just a beautiful outer covering, right? It actually protects our internal organs. Our skin has this very robust immune response, so it's like the first protection we have against pathogens, bacteria, microbes, things like that. And it also is a reflection of how healthy we are on the inside. So I could name dozens of times where I've seen someone for something unrelated to their well, I'm sorry. I've seen someone for a skin reason, and I might look at their leg and say, one of your legs is way more swollen than the other. And they actually, I had a blood clot in their leg, or a young woman had this kind of wrinkly skin on her neck, and I'm seeing her for a mole in her scalp, and I'm thinking, she shouldn't have that much sun damage at 24. And really what she had was this internal condition where the elastic in her blood vessels and in her skin were abnormal. And usually this presents later in life with eye problems or heart attacks or things like that. But because I was seeing her, I noticed that, wait a minute, this isn't right. So I love that about the skin. Like it's a window to what is going on internally. And so, especially as I've gotten older, I really find that if you really want to take care of your skin, first and foremost, you have to take care of your whole body on the inside. And I think sometimes we look at it the other way. We're like, well, what products and stuff can I slap on, or device can I get? When really we need to be thinking about it from the inside out.
So, what are some of the environmental impacts that we are experiencing on with our skin that's affecting our skin, and trends that you're seeing these days as we're much more health conscious, we're much more environmentally conscious. I'd like to think, and
Yeah.
what are some trends that you're noticing, maybe that are surprising that there's just not being talked about, or trends that that you suspect are going to become an issue later on?
Yeah, well, I would say one of the biggest is sun exposure and sun damage, UV radiation. That's a big one. We spend more time outdoors, doing more vacations, and so and we're living longer. So that's something I see. I mean, I used to think skin cancer just happened in people who are 50, 60, older, but now I am seeing people in their 20s with skin cancer. And if you're going to live to be 90, that's a problem, because it's based on cumulative sun damage over the years. So I think that's going to be an issue as people live longer, and as we get better at taking care of these things like transplants. So we know that patients who are immunosuppressed, especially transplant patients, we're getting so good at saving their organs and making sure that they work. But the side effect is that they have this chronic immunosuppression, and so they're more prone to things like skin cancers. Another big one is pollution. So, there was a study a couple years ago about benzene in some of our skincare products, and people were really concerned and worried, and rightfully so, right? Like that needed to be looked into for sure, because benzene is a known carcinogen, and it should not be in our skincare products and personal beauty products. And it turns out it was a contaminant during the manufacturing process. But what people don't realize is benzene's we're around it all the time. Like if you live in a big city, a lot of pollution, if you smoke cigarettes or you're around smokers, like that all has benzene in it, and that is going to affect your skin. So those are kind of two main ones, like pollution and UV. And then of course what we eat, we're realizing like that really can affect our skin as well. That's not a external toxin per se, but I guess the thing, you are what you eat, like we're now realizing like your skin reflects that as well.
You mentioned something that's grabbing my attention right now. So benzene, so we are surrounded by it. It's a little alarming in how you paint the picture, in that, say, someone who smokes, I would imagine, whether it's cigars, cigarettes, or maybe is it just cigarettes, or just a variety of different things, that if they're chronically exposed to, if a person is exposed to secondhand smoke, then that can be detrimental to their skin health. That can affect them as though they were a smoker.
Absolutely right, and not just your skin. We see people. I actually just had a patient the other day who was saying his how he hated smoking, but he ended up marrying someone who smoked, and he ended up getting lung cancer because he was around it that day in and day out. Now that we don't allow smoking in public, and I feel like we've done a good job in this country of making, smoking is no longer all around us necessarily. So hopefully we'll see a decline in that. But yeah, just you are still inhaling it. Your skin is still exposed to it. So secondhand smoke for sure can affect not just your skin, your lungs and internal organs as well. And people think, like the younger kids today, they think vaping is a safe alternative, that it doesn't have all the carcin or all the additives that cigarettes have, and you're not burning and smoking. But the nicotine, it's still nicotine, and that affects your blood vessels and all your organs, including your skin. So I would say nicotine's another one. And just because you're not smoking a cigarette and you're vaping with an e-cigarette, it's not healthier.
I like this conversation because even though it seems as though people are less likely, or it appears as though there's less smoking happening around us, that it's not as prominent as, say, decades ago, it's still an important topic to address, and the impacts. How accelerated does the aging process impact the skin when a person is exposed to an environmental pollution such as the smoking, or the different elements that really that negatively impact the skin? Like, how
Yeah.
fast are we accelerating the progression of the skin deteriorating?
Yeah, I would say exponentially. It really makes a huge difference. And there in our derm literature and studies, like and actually one of my girlfriends, they had a post that went viral because they were seeing a patient in rural Texas, and he always had a t-shirt on and he always wore pants, and the picture of the skin that was sun protected for decades of his life versus the skin that wasn't. I mean, people thought it was Photoshop. People thought it was a different person. Like the difference between his skin simply from being covered and sun protected and not was unbelievable. Like people really thought it was fake. And of course I see this all the time, and I was like, no, like that happens. That was an extreme version. But or they've shown pictures of truck drivers who sit, they're driving a truck 30 years of their life, and the sun is just beating down on the left side of the window. The left side of their face is significantly more damaged than the right. So and smoking, and also your diet too, like all of these things exponentially age you, your whole body, including your skin. Your skin's going to reflect this. And so again, all the creams and all the Botox or fillers in the world aren't going to help if you're still doing these things to your body. So especially if you're someone who's like, I don't want to do cosmetic stuff, I want to age gracefully, I want to age naturally, then I would say that's wonderful, that's great. And I would just say, if you can be vigilant with sun protection and healthy eating and exercise and not excessive drinking, not smoking, you really won't need these things down the road. So but it's like prevention is way harder, right? People are like, well, just give me the pill or just give me the device, to erase all the indiscretions of my youth, right?
Is there any part of the aging process you can reverse within skin health?
Well, there people are definitely looking at it. I'm trying to see if like really, truly, truly reverse. I mean, um, I think at this point, I don't think we're quite there, but certainly people are really looking hard at how do we reverse. Well, I guess I would say it's regenerative medicine, right? If you're familiar with that term, which I think is just going to explode. Like we're in the early stages of it now, but this is really where like medicine is going to take off, where we can really reverse things instead of right now the way healthcare and medicine is. It's like we wait for a problem and then we try to stamp it out, right? Which worked fine when your life expectancy was like 50 or 55. So regenerative medicine is this amazing field that's coming out. And we do have some forms of regenerative medicine right now. If you've heard of like platelet rich plasma, using the platelets of your own body, people will inject them for like arthritis into your joints. We use it for hair regrowth to help stimulate your hair, make it thicker. You can also put it on your skin as well. People are looking at exosomes, if you've heard about that. So,
What is that for our viewers who don't know?
yeah, well, so I guess let me start by saying sort of like the epitome of skin or rejuvenation or I would say like this whole regenerative medicine, like the peak is a stem cell, right? A stem cell can become any cell in your body. So for a long time, people are like, if we could just harness these stem cells and tell them what to become, like become a new heart, become a new limb, become a new skin cell and heal. The problem is, stem cells, we have them in our body, our fat and hair, those are stem cells. But the best stem cells are like the really in really young skin or really young tissue. So placental, umbilical. But then people hear about like, are they using fetuses for stem cells and stuff like that, which they're not. And it does have some ethical concerns there, of course. So sort of the next best thing. So stem cells are kind of complicated. There are some ethical concerns where you harvest them and get them. But what stem cells produce are these little messages, and these messages can be packaged in what's called an exosome. And the exosome is like the little envelope carrier. And what researchers are realizing is, well, maybe we don't really need the stem cell. We just need the message. And if we can package that up, then we can still get the same benefit. And it's potentially easier to get and easier to amplify and magnify. And so as of now, we only have topical exosomes, and they're still early on, but basically the thought is you could rub on a cream with exosomes that stimulate your fibroblast and collagen. And so you rub it on your skin, the message goes down to your fibroblast, tells them to work harder or build, and then you get thicker, plumper skin. Or you could have exosomes if you have a burn or a wound that's not healing, a diabetic leg ulcer. You could rub your exosome cream on, stimulates wound healing, and then it's healed. So those are like where things are going. And it's like the wild, wild west a little bit out there. So I just tell listeners to like, be aware. There are a lot of people making these like grandiose promises. If anyone's offering you like IV stem cells and stuff like that, is not regulated, it's not approved just yet. But I think in the next 5 to 10 years, we're going to be having a whole different conversation about this as we really try to literally reverse aging, get rid of these senescent cells in our bodies called zombie cells that are just hanging around being bad influences for the rest of our cells, and trying to truly reverse the clock.
So from what you're saying, it sounds like there's a lot of different approaches, and that in the area of stem cell, this is, it's almost like story developing. It's one of my favorite phrases,
Yeah.
that things are still rolling out. It seems like there's an optimistic approach to helping to have that level of rejuvenation and the benefits that it can have from the body. And I think the regeneration, I think it sounds like an exciting term, and And it sounds like it's something that that we look forward to rolling out for the future.
Yeah, and I think the future is pretty close. Like there are some stuff coming out even within the next year. And I think probably for a lot of your listeners, right, we want to we want to be as healthy and as vibrant for as long as possible. And for a lot of listeners, their chronological age may not match with what we call your genetic age, how you feel on the inside, because you're taking care of your body, you're working out, you're eating well, and you're not going to just turn 60 and like wither away in the corner, right? Like we want to have these robust lives and be moving and everything. So I think, yeah, this is such a cool area. I'm really excited. I think it's a great time to be alive because there's just this big push for prevention, rejuvenation, and let's not just live long, let's live healthy and vibrant as long as possible.
Absolutely. We're going to take a commercial break. We're going to continue this conversation. Stay put. Don't go anywhere. We will be right back after this. Hey everyone, welcome back to Fit Bites. Today we're diving into why strength training isn't just for athletes, it is literally anti-aging. Now let's explore how this essential form of exercise keeps us strong and vibrant, especially as we grow older. Strength training encompasses various forms, each with its own benefits. There's traditional resistance training, which uses weights or bands to build muscle and bone density. Then there are isometric exercises, like planks or wall sits, where you hold a position without moving to improve stability and core strength. We also have isometric resistance training, where you push against immovable objects. Now, this method increases muscle tone and strength without the wear and tear of moving weights. So, why is this crucial as we age? Strength training boosts metabolism, maintains muscle mass and bone density, reducing the risk of osteoporosis and falls. It keeps our bodies capable and functional, allowing us to enjoy a high quality of life as we age. Incorporating strength training into your routine a few times a week can make a significant difference. It's about more than just muscle. It's about empowering your future self. Stay strong, stay healthy, and tune in next time for more Fit Bites.
Hi, I'm Emily, and I live in Colorado with a very active lifestyle where my family and I race horses and rodeo. I'm happy to share an amazing technology that has changed my life. 6 months ago, my friend introduced me to a wearable nanocrystal technology that is activated through phototherapy, or your own body's light. With this technology, this little patch is able to increase the copper GHK peptides in your body, which can reactivate stem cells. The beautiful thing about stem cells is that it goes in your body and fixes whatever's broken. If you would like to experience more energy, better sleep, weight loss, or countless other benefits, click on the QR code below to find the younger, healthier you with this affordable technology that I have seen change hundreds of lives.
Welcome back to the Health Revolution. Welcome back, everybody. My guest today, Dr. Mina, she's a double board certified dermatologist. She's also the podcast host of The Skin Reel. We're talking about how our skin is is impacted by all the things that we do, and what can we do to help rejuvenate that in all, to help our lives be as optimized as possible. And so before the break, Dr. Mina, you were talking about the different elements that we experience in society, the environmental pollution, some of the practical situations that we may not know affect our skin health, which affects our overall health. I want to switch gears a little bit and evolve to the topic of what happens when we turn 40 and then beyond. So, of course, the hormonal changes are entering the picture, and and oftentimes we're noticing changes in our body, including our skin. So, what are some things that you've seen that women experience over 40 that are directly impacting their skin, and how do you address them? How do you help women over 40 address skin changes that are happening?
Yeah, definitely. So as a woman, over 40, I'm not only a doctor, I experience this too, right? So yeah, it can feel like you wake up, and especially for women who are right around menopause or right after menopause, it can feel like your face is just fallen, like you literally overnight. And, but usually what I'll see, like if they're in their 40s, they'll come in, they might be saying, I'm getting more acne. I've never had acne before. Now I'm breaking out like I'm a teenager, or like my teenage child, what's going on? But a lot of times people will realize their skin feels crepey, or maybe it's wrinklier than usual, or they start noticing some jowls along their jawline, some dyspigmentation. So their skin maybe used to be more evenly complected, and now they're have discoloration, and they just feel like they've aged, or their eyes are sunken in, and they don't feel like their vibrant self that they're used to, and they're wondering what's going on. And I think during this time for women, first of all, I feel like we're finally talking about it, which is great, but I still feel like it's like a negative word. Like I asked a patient once about whether she was still having her periods and things, and she was almost like offended, like, oh, I'm not menopausal, I'm not perimenopausal. Like it's this bad word, or like, don't accuse me of that. Which it's a normal part of life, and we shouldn't treat it like it's something that it's a bad word, we can't talk about it, right? Like that's the first step, is acknowledging it, that yeah, and I might be going through perimenopause. I'm not sure. Here's what I'm feeling. Here are my symptoms, and not just dismissing it or thinking, oh, it's just for old people, don't talk about it. But I do find that like the skin, it's one of the first areas that we start to notice this, that and maybe some irregular periods, as your estrogen might be really high one month, and then it might really drop another. So it's kind of all over the place. And that can also lead to the acne that people see. A lot of times people are really thirsty, or they feel like their skin is really dry. That's another issue. Maybe you've always had oily skin, but all of a sudden now it's really dry, or maybe sensitive, and you didn't have that problem before. And so they might be coming to see me before they even go see their gynecologist to talk about menopause or perimenopause. I think people don't realize how it happens. You could be in perimenopause for 5 years, up to 10 years before you hit menopause. So average age of menopause is 51 in the US. So you could be in your late 30s and having some of these symptoms and still be, normal, right? So that's kind of what I see. And I sort of feel like I kind of joke, like people can sort of fake it with their skin, or they can abuse their skin and body in their 20s, maybe into their 30s. But once you hit 40, it's like it gets real. You can't fake it anymore. You have to come to the realization that you can't just wing it. And you really, if you want to have beautiful skin and you want to be healthy, it's time to make some changes.
I love how you're addressing this. And I have to agree with you that these days the conversational landscape is changing around perimenopause and menopause, and that in fact it's long overdue. And so I certainly, I'm quick to imagine that part of that discomfort has everything to do with that we're not used to talking about it. So,
Yeah.
and then we're thinking of preconceived notions of what aging means. And so now there's a mixed bag of reactions, and maybe a little bit of fear that, oh no, now I'm nearing the end of something, that the fun is now over, or some of what might come up in conversations with women. And so I love the fact that you have a keen eye and you're noticing things in maturing skin as we're getting older, because I mean, we're all getting older. And so, what are some fascinating facts about the skin that you are quick to learn about that maybe one of your patient or that your patients don't see right off the bat, that helps you determine what's going on with them, just overall health, menopause, perimenopause, or just health conditions in general? What are some fun facts of what you—
Yeah. Well, I don't know if it's fun, but it's a fact. So,
interesting facts? What are some interesting, not, we don't always know about facts?
yeah, well, so this is really surprising. So, our collagen levels start to decline even in our early 20s, about, you could say, average about 1% a year. So, even people in their 20s who, we think of as having like amazing skin, and we all would go back to that, right? They're even losing it. But once you hit menopause, or within the first 5 years of menopause, you can have a 30% drop in your collagen. Okay, that's huge. That's huge. So that's where that whole concept of, I feel like my face is falling, comes from, because it can be quite a drastic drop. And so I kind of joke about being like in your 40s, like I have a Swiftie at home, so I'm in my collagen banking era, right? Because I know it's coming. I know I'm going to have this drop in my estrogen. I'm going to have a drop in collagen. So I'm doing everything I can now to like put the money in the savings account, put the collagen and bank it up, to save it up, because I know that's coming. So I think if you are in your 40s or haven't hit menopause yet, like, this is a great time to really take a good look at your life and what you're doing. We know it's coming, right? God willing, if you live to make it. And so what can you do to make sure you're as healthy as possible? And so starting strength training, like, you could talk about this more than me, right? Like, don't wait until you're 65 to start doing strength training. Like, start it as soon as possible. And this is something I always thought, oh, I'm going to get big, I don't want to strength train, but that's so important. And the earlier you can do it, right? Like, am I right on this?
Yes, the
and
earlier the better.
and
Yes.
here's a fun fact. This one is fun, unlike the collagen one. So they've actually looked at studies between people who do cardiovascular exercise versus those who do weight training. And of course, both are good for different reasons, and both release cytokines to our body and endorphins. But what they realize is that the cytokines that are released, or the myokines from your muscle when you do strength training, are different from the ones that are released when you do cardiovascular training. And the studies showed that actually doing strength training, the patients that they looked at had thickening in their dermis, which is the layer of your skin that has your collagen. And so it can potentially be boosting and building your collagen, as well as giving you healthy, strong muscles and helping prevent osteoporosis and breaks and all that stuff. So it's not just good for your muscles, right? It's actually good for your skin. So another reason to start doing strength training. I've really taken a hard look at my diet. I always thought I ate pretty well. I was vegetarian, then pescatarian for about 27 years of my life. And only recently did I start feel like I was craving protein. And I was eating a lot of Impossible Burger and substitute fake meat. And I just, at least for me personally, I felt like I should just eat humanely raised chickens and cows and things like that. Like, I could tell my body needed more protein. And so increasing your protein can be helpful, not only for muscles and your body, but also for your skin as well. And that helps. And of course, I like to do certain procedures. So not everyone's going to want to do cosmetic procedures, but I do find biostimulants, these things called Sculptra Radiesse, they can actually boost your own collagen. So it's very natural, gives very natural results. Again, it's all about collagen banking. So it helps build up the collagen that you might be starting to notice you've lost along your jawline or cheeks, things like that.
What is your take on collagen supplements specifically that are out there, whether it's peptides or liquid or just some of the different variations that we've seen out there?
Yeah, so there definitely have been some studies that show it can be helpful, and they've looked at more of the hydrolyzed collagen that's sort of broken down, and it's kind of mixed reports. Like you can certainly find some that say no benefit, and then you can find some that say actually there's an improvement in skin elasticity and hydration, and improvement in lines and wrinkles. So I'm kind of doing a test on myself, like I am adding some to my morning coffee. I feel like it's pretty low cost and safe, and it might work, maybe not. So I'm giving it a try. It's too early to tell. Like it takes time, and I would say don't think that this is going to solve like all your problems. Like even if it does work, you still got to do all the other things that we're talking about and taking care of your body as well. And you're still going to lose that collagen, right, as you lose that estrogen, but again, it's all about like collagen banking. So I think we'll get more studies, definitive studies on that. But I'm giving it a try. I don't know. What are your thoughts on it?
I'm curious. I for someone like me, I've taken collagen peptides before of a variety of different products, and then a liquid collagen. And I've noticed that, I'd like to think that I'm on the drier side. I'm 51, and so I've noticed my skin is a little bit drier. But then I'm trying to pay attention to skin, hair, and nails,
Yeah.
and so. I think I'm looking and I feel like I'm watching grass grow, but but
Then you're
uh,
doing it right.
well, and I just I see the convenience behind taking something that bridges the gap
Yeah.
and being mindful of it. And I was so I feel like I'm doing something good for my body, and that I do take collagen supplements. I every now and then I might miss a day or two, or but overall I'm consistent.
Yeah.
And so I'm curious with the women who you've worked with that have been taking collagen supplements, and then maybe those who have disclosed that they don't. Are there any subtle if there are there any subtle changes? Are there any just incidental noticing of the difference between their skin? Maybe some
Yeah.
characteristics.
I don't know if I could parse it out just to the collagen, but for sure, there's a big difference in the people who have a healthy lifestyle and those who don't. So I can tell when they come to see me and they're in their 40s or 50s, whether they've been consistently using sunscreen, whether they smoke, whether they drink excessively. All of these come out on the skin. So I don't know if you can't just take collagen and still do all those things and think it's going to wipe all that away. So I don't know if I can parse it out just to the collagen, but people who take collagen tend to also do these other things like you do, and sort of watch what they eat, and all the other healthy stuff. And so it's conceivable that it could help. And there are some studies showing that it can help. So I think we just need more data, but it's pretty easy. No, I can't think of any real side effect from it. Relative low cost. So I think it's worth a try. And if you notice a difference, go for it. But yeah, it's slow. It's not fast. And, just plan on being on it for, I would say, a good 6 months or longer to really see a difference.
One quick question before we go to break. Do you notice a difference in skin changes between men and women over 40 and beyond? Anything that differentiates the gender?
Yeah, well, so men don't have that precipitous drop in their estrogen, and
Mhm.
our skin cells have estrogen. And so for men, like they'll notice, and women will notice hair thinning too, right? But so the men don't seem to have that drastic drop. They don't have that drop like women do. And so for women, I feel like it's sort of accelerated versus men, it's more of a slow process. But I also find women are better at taking care of their skin and their bodies a lot of times. Men, they'll be golfing and tennis or fishing or whatever they do. They don't wear sunscreen, they don't wear hats. They're just not in general, right, as proactive about their skin health. And so I'm seeing a lot of men for skin cancers. I'm seeing women as well, but men just don't have that drop in the estrogen like we do. And so it's just accelerated for us.
I think that's an important point to note. And we're going to take a commercial break. Stay put. We'll be right back. Don't go anywhere. We will be right back after this. Thank you so much for watching The Health Revolution. Our show is growing, and it's all thanks to viewers like you. No matter how you found us, please hit the subscribe button so we can stay connected and continue to deliver amazing content to you.
Life is so fragile, and we're constantly reminded just how fragile life can be, especially when we or a loved one is told we have cancer. Cancer survivor myself, I can tell you, we still feel very alone in this journey.
There's a study that's been showing that patients who are socially isolated have a worse prognosis, have a worse outcome than patients who are socially interconnected.
Buddies for Life is a non-profit cancer support group for those whose life has been impacted by cancer. Humor, hope, heart, and hugs.
Humor, hope, heart, hugs, and a whole lot of love.
Share this with your friends and family and support this community in every way you can. No one should face cancer alone.
I am a chemo buddy for life.
We are a buddies network.
No one does cancer alone.
Be a buddy.
And we are all here for you as a community of love.
We are chemo buddies for life.
And if you've heard 3 words, you have cancer, for yourself or someone else, you belong with us at Chemo Buddies for Life.
Healing through connections.
We can take our own health into our own hands. Okay? So we'll kind of expand on that. So I take a lot of vitamins every day. Long before I started this business, my wife has had me taking my vitamin C, my B complexes, amino acids every single solitary day, and I still do, even though I still do IVs as well. But when you take vitamins orally, you get 15 to 20% of them. Some people get less because they have autoimmune issues. Some people have a lot of inflammation issues, whatever the case may be, so they don't get the absorption that they need to be getting. So they don't get their immune system built up. Doing the mobile IVs, I'm able to take your immune system, I'm able to naturally boost it.
Welcome back to The Health Revolution. Our guest today, Dr. Mina, double board certified dermatologist, and we are talking about skin health and optimizing that and correlating it to optimized health. And Dr. Mina, before the break, we were talking about the difference in genders and obviously the emphasis being over 40. And you've done an array of procedures just all together. I'm curious, what are some procedures that are helpful in maintaining youthful looking skin with those patients who are on top of their self-care and they just want to just have a polished look?
Yeah, so great question. And really everyone's different. So when someone comes to see me for a cosmetic consultation, I usually give them a mirror and I want them to tell me when they look in the mirror what bothers them, because what I see, it may be very different. It doesn't always match up, right? And so I want to hear in their words, like when they look at the mirror, what's the one thing they can't stop thinking about or really bothers them? And then I'll give them kind of my thoughts, especially if it's different from what they're saying. But in general, sort of my number one is, when you come to see me, you may have like a list of things you don't like about yourself or you want to change. But the number one thing for me is get your skin radiant and healthy and beautiful, get an even complexion, remove any sort of age spots or what we call dyschromia, sun damage. If you can do that, everyone's skin looks better. All of a sudden, those wrinkles, the skin laxity, everything you thought you hated, it gets better. It's really remarkable. Just having like beautiful, even complexion. Like my goal is for someone to say, I don't have to wear foundation anymore. I don't have to wear makeup anymore to cover my skin. And if I can get your skin glowing, I mean, it makes everything better. So that's usually where I will start, unless there's something a rare example or a rare case or something else. So we can do that in a different ways. Of course, at home, I love a retinoid product. That's like a good night cream. It's like my go-to night cream. You don't have to spend a lot of money on it. And then I love chemical peels. I'm a big fan of chemical peels. There's all different strengths. In my office, we don't have devices, but certainly there are tons of devices out there. What I find with the devices is you have to do more frequent treatments, but there's less downtime versus a chemical peel. It's kind of one and done, but the downtime may be more significant. So, but both are great options to kind of rejuvenate the skin. And it depends on your skin type. So if you have more pinks in your skin or more blood vessels of concern, you may want to tackle that with different laser. If you've got more pigment in your skin, then we need to be careful that we aren't using something that will cause you to what we call hypopigment, get white spots or get darkening of the skin. So there are some nuances there that you have to take into consideration as well. But first and foremost, I would say, like, if you're feeling discouraged when you look in the mirror about how your skin looks, like getting something that sort of evens out your complexion, I think makes most people feel tremendously better about themselves.
What is your favorite way to approach dark spots?
Ooh, dark spots. I would say a chemical peel, especially if someone's more my complexion, then I would do a strong chemical peel. If someone is more your complexion, I would probably do a lighter series of lighter chemical peels or lightening creams, because I'd want to be really careful not to overdo it. And then we got rid of your dark spot, and now we gave you a light spot, and you wouldn't like that.
No, I would not. So I love the conversation that we're having, because it's not very often that we do talk about skincare in the way that it optimizes our health. And speaking of conversations, I do want to shed light on your podcast. So we're going to bring up the slide here. Talk a little bit about the Skin Real podcast. When did you start it, and what's your goal for your podcast listeners?
Yeah, well, so I started it about 2 years ago, and I had realized I really got into podcast during COVID. I never really listened to podcasts before, but for whatever reason, I started getting into them, and I thought this is like such a cool way to learn. I was learning stuff, and then what I realized is that there's not enough dermatologists being in the U.S., and there's not enough being trained for the future population growth. And I know in my visits, we take insurance, and it's hard to get in. The visits are short, they're rushed, and I don't feel like I get to address all my patients' concerns in that one little visit. And that the role of prevention is so key. And I also felt like I was getting a lot of questions from my friends, right? This is right around the time I was turning 40, and my friends are coming to me like, does this really work? Should I use this? What's going on with my face? And I thought, I need to just put all this into, the universe, record it and put it out there. So people all over the world, if they're wondering, how do I take care of my skin? I'm 45. What's going on? They can get the guidance of a Harvard trained dermatologist without having to go in personally and see someone or wait all these months. And so I really just hope it gives people real, unhyped, unsponsored skincare guidance. And I really take a more simplistic and holistic view rather than trying to tell you all the products you should be buying or using. I try to give you guidance on, maybe the actives to look for or ways to address it without the hype. So hopefully that's what listeners get when they tune in.
What was one of your most favorite comments or feedback that you've gotten from your podcast?
Well, I don't know if you ever feel this way because yours is more of a TV thing, but sometimes when you're recording, especially when I was doing solo episodes, I would think you're sitting in your room looking at yourself in the mirror or the camera, and you're like, is anyone listening? Is anyone hearing what I'm saying? And but then I started hearing people either reach out to me on DMs, or sometimes it'd be a patient. They say, hey, I love that episode you did on whatever. And I was like, oh, awesome. Great. So someone is listening. People do hear it. It is getting through. And another thing I love about having the podcast is when I am seeing patients and they're asking me, what do I do for skincare in my 30s? Or give me some tips for my whatever, I can say, oh my gosh, I just did a podcast episode on it. Here you go check it out. And they can go listen to that as well. So it's been a lot of fun, and I meet a lot of great people, and it's opportunity, like people like you doing really cool things, helping women, helping people stay healthy and vibrant in midlife, and just kind of reframing what it means to be 40 plus, right? Like gone are the days of just, being over the hill. We're going to just fade into the background. Like that's not how we're going to treat the second half of our life.
I loathe entirely that phrase for sure.
I know.
Yeah, over the hill. So
what hill? Yeah.
I know. We're going to take a quick commercial break. Don't go anywhere. Don't go anywhere. We will be right back after this. Welcome back to the Health Revolution. Welcome back, everybody. My guest today, Dr. Mina, double board certified dermatologist. And we've been learning so much about skin health and what we can do to optimize it, that level of regeneration and all things that implies. And Dr. Mina, where can we find you in the virtual space?
Yeah. So definitely check out my podcast. It's on all the platforms. You can find it through wherever you like to listen, or my website, theskinreal.com/podcast. And if you're sitting there wondering, like, I don't even know where to begin, I don't know what to do, where to start, I have a PDF that you can get. It's called How to Create Healthy Skin Habits. And I talk about how really pairing your skin needs with your goals is really how you make your personalized individual skin habits. So you can go to theskinreal.com/habits for that. And I'm at Dr. Mina on all the social media platforms. So definitely reach out there, or come see me in Atlanta, Georgia.
So Facebook, where else are you? What other social media platforms are you on in addition?
Yeah, so I would say I'm most active probably on Facebook, Instagram, and TikTok. And then all my podcasts are on YouTube. So people like to watch podcasts, which I didn't know. So if you're not into audio, you can watch it.
And then, of course, your handle is Dr. Mina Skin.
That's right, at Dr. Mina Skin.
Gotcha.
Yes.
What do you have going on for the remainder of 2024, and then entering this year coming around the corner, or so it seems?
I know, right? Wait, are we? Yeah, we just started third quarter, so this year's plugging away. So yeah, I just actually finished up a virtual summit this week, and I have one in August in Atlanta, if you're in the area, called She Who Elevates. So it's just a inspiring group of women coming together with talks on finance, beauty, health, wellness here in Atlanta. So She Who Elevates, if you're in town for that. And I release a new podcast every Monday, and then I also do a recap episode. So my format is mostly interviews with different people, and then you'll get to hear my kind of quick recap takeaways on Thursday as well. So that's kind of what I'm up to. And of course, seeing patients and just trying to put out really good, real skin education for people.
What is the one thing that you love to do to stay optimistic about our health, our skin health, that I would love for you to share with our viewers, with things to keep in mind?
Oh gosh, the one thing, you know what? I think community. is really, really important. And you got to look at who are you surrounding yourselves with, right? They say you're the average of the 5 people you hang out the most with. So are you hanging out with people who also value taking care of their bodies and health? Or are you hanging out with people who are trying to tell you to like derail you from your health goals and everything, or encouraging you to have bad habits? So I think community is everything. And nowadays with the online world, and since COVID, right, we know we have all these communities all around the world. You can find your people, but I would say find your community of people who are like-minded. They also are interested in longevity and health, and will build you up and not put you down. And I talk about this with skin and beauty and everything, that unfollow the people who make you feel bad about yourself, or who are always telling you to buy stuff, or you need this, and the friends as well. Because you don't need that, right? Like we're beyond that by 40 plus.
Absolutely. Dr. Mina, thank you so much for your time, your energy, and the receipts that you bring about the largest organ in our body and the impact that it has. Thank you so much for being here.
Oh, thank you so much for having me and all the great work you do. It's wonderful.
Appreciate that. And for all our viewers, of course, you can find us on the internet. Our website is thehealthrevolutiontv.com. We are updating more information as we are continuing on into season 3. You can you can subscribe to our newsletter. You can send us an email for any show episode ideas that you would love for us to cover, that we will definitely deliver for you. Upper left-hand corner of our screen, you're going to see our QR code. Grab that in terms of as the crow flies. And then, of course, we want to thank our sponsors, and we are always on E360 TV every Tuesdays and Thursdays. You can find us 10 a.m. Pacific, 1 p.m. Eastern each and every single week. That is all the time that we have for today. Until next time, please take care of yourselves. We will see you soon.